Thanks for staying with us. Many things can put you at risk for heart health issues. Some you can control and some you can't. But knowing how to talk with your doctor and understanding your personal health risk factors could be life-saving. Dr. Chris Godlewski is still with us to share some expert advice, so thanks for staying around. So are women at a greater risk for heart attack or cardiac health issues compared to men?
They're not. They're about the same. Actually, there may be slight preponderance of risk in disfavor of men in terms of heart attacks and coronary heart disease. Women tend to be at somewhat higher risk for heart failure, especially at the older age, and especially one particular type of heart failure for which women have a higher preponderance.
And so we've mentioned age. Why is age a risk factor when it comes to your heart health?
Well, so age is the risk factor in terms of every disease. You know, the older we get, the more health problems we tend to have. You know, childhood has its own diseases, early adulthood has its own set of diseases, and the older age has its own. So, you know, of all the risk factors for any disease, really, the age is consistently the most important risk factor. And of course, we cannot change our age, but we have to be prepared for it. We have to be able to address it and anticipate those changes as we progress through the years of our lives.
So as we get older, should we automatically be talking with our doctors about our risk for health issues when it comes to our heart?
Yes, but we should actually talk about it since the early age, because the risk for heart disease at old age is a result of accumulation of the risk factors throughout the lifespan. So it really starts with the childhood, with what we learn about to go about our daily living that can ultimately result in health problems in the later age. So identification of certain diseases, like common diseases, you know, which people tend to ignore perhaps or not pay enough attention, like high blood pressure. High blood pressure starts at an early age. Usually teens and 20s, you have some inkling that a person may be at risk for high blood pressure, and that accumulates over the years, and over time it may result in all kinds of problems, including heart attacks, strokes, heart failure, and so forth. Diabetes is a disease which also can be identified at earlier ages, and it creates a risk in later life. And also, you know, the lifestyles, you know, unfortunately, we're dealing here in the United States with an epidemic of obesity, which is a very complicated problem. One of the components of this problem is the way we go about our daily life, you know, the inactivity in our life, physical inactivity, type of nutrition we get, and so forth. So those things can be addressed throughout the course of the life. At a later age, you know, in the middle age, in people who are in the middle years and older, this should be addressed with your physician and should be discussed, and remedies should be taken.
Okay, so age, diabetes, obesity, high blood pressure. How do you talk with your doctor if you're concerned about your risk for heart health? Do you have any advice on how to start that conversation?
I think this is very individual, but you know, people who are at risk, who have certain underlying health problems, like for instance diabetics, like for instance people with high blood pressure, should be aware that those things have far-reaching ramifications. And that, you know, with the diabetes, the control of sugar is not a goal in itself, but it has its own ramifications later on. That taking preventive measures to remedy the risk factors for diabetes have ramifications. You know, unfortunately, there is no single recipe for how to address it. It's very individual. I think that everybody should be aware, however, that these problems are very common, and they have to be remedied if we want to avoid consequences in our later life.
Can you talk about some of the more common tests that a person might go through if there is a concern for heart health issues?
So there is no single test.
Okay.
You know, again, history, telling your doctor about how you feel about your symptoms, checking basic things like blood pressure, checking basic labs, checking cholesterol levels. Those are the kind of common sense tests that can be helpful in structuring the plan for health maintenance in the future. Unfortunately, there really isn't a practical way to detect somebody who does or does not for sure have coronary disease. Now, there are tests, of course, we do them, but the way they work is such that they are not suitable or not practical to apply to the population. There is a screening for heart disease. So we really have to operate in the world of identifying risk factors, realizing the risk factors, and modifying them.
Okay.
It is really always a I want to say game, but it's not a game really, but it's a matter of understanding the probabilities of risk and affecting those probabilities by modifying the risk.
Okay. And we were talking before the show about heart disease, heart health issues, heart failure, and these all have some subtle differences. Can you talk specifically about heart failure and what that is?
So heart failure is a very complicated area. The heart failure is kind of a catch-all term that encompasses multitude of heart diseases and heart problems. In terms of women, there's one type of heart failure which is called heart failure with preserved ejection fraction. Long name. Essentially what it means is that when you look at the structure of the heart and function of the heart, it seems to be normal. In other words, the muscle appears to contract fairly normally or normally, and yet the person develops symptoms of heart failure, as opposed to heart failure in which muscle is weak and doesn't contract properly. Unfortunately, whether the muscle is weak or not weak, we have heart failure, the prognosis is just as bad. It is a dangerous disease. It's a disease that affects the quality of life and which also shortens the lifespan quite a bit. And the problem with the heart failure with preserved ejection fraction is that, first of all, women are much more, at much higher risk than men, 3 to 1. Okay. So women are at higher risk for heart failure with preserved ejection fraction, and there isn't really a very effective way to treat it with medication. Just medical treatment doesn't work very well for it, and the only thing that works seems very simple, meaning proper diet and exercise. Unfortunately, that's very difficult to implement.
Sure. Okay. Well, we're out of time, so we do need to go, but thank you so much for all your information and your expertise. We appreciate you being here. Bottom line, though, is try to eat well, get some exercise, and talk with your doctor. Okay,
yes,
perfect. Thank you. And thank you for being with us today. We hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.